The Evidence2Practice Ontario program is supporting the delivery of care across the province by making it easier for clinicians to access and apply best practice information and quality standards at the point of care. E2P is co-led by the Centre for Effective Practice, eHealth Centre of Excellence, and North York General Hospital, and funded by Ontario Health. Disclaimer: our goal is to support clinicians with care decisions while also optimizing clinical workflows. Please consider these supports a supplement to clinical care rather than a replacement. We deeply value the work clinicians do each and every day to provide high-quality patient care. Welcome to the E2P COPD Management Tool, your comprehensive companion for COPD screening and management within TELUS PSS EMR. In primary care, timely and effective interventions are essential to improving patient outcomes, preventing exacerbations, and reducing hospitalizations. Join us as we navigate through its features and functionalities. The tool is designed to support evidence-based decision-making by presenting key clinical information, guiding assessments, and recommending appropriate interventions. By integrating seamlessly into the workflow of physicians, nurses, and other clinicians, this tool promotes personalized care and helps optimize treatment strategies for COPD patients. Key features of the tool include assessing the severity of COPD by utilizing patient data such as spirometry results, symptoms, and comorbidities, promoting personalized patient-centered care by recommending evidence-based treatment options tailored to the individual patient's needs, ensure consistency in clinical decision-making across care teams, and enhance collaboration and communication among healthcare providers involved in the patient's care. For a patient with new or recent respiratory health struggles and/or concerns, clicking on the COPD button will initiate the screening and diagnosis section of the tool to open. In this workflow, users can update the diagnosis status. This will prompt the users to capture the status using spirometry results. You can enter the date of the test, the FEV1 over FVC ratio, lower limit of normal value, and FEV1% value. Once the values have been entered, red text will appear to aid in clinical decision support, and users can add the diagnosis to the problem list directly from within the form. Users can check for identified symptoms, which will trigger the tool to search the CPP, or users can manually select the respiratory symptoms and risk factors the patient exhibits, all while the form counts the number of matching factors. Users conveniently have the option to launch Ocean to trigger the external referral or send an internal message for internal spirometry testing. After the screening and diagnosis portion has been completed, users can click on the COPD icon, and this will launch the full visit tool, and may want to conduct a COPD assessment, assess for dyspnea, or record any exacerbations the patient experienced. Embedded into the visit notes section is the symptoms stamp, which triggers a block of text to appear and allow user to efficiently document information related to COPD symptoms in a structured and standard format. COPD is a complex condition that can progress over time. This form is designed to track that progression, enabling users to easily update and adjust a patient's treatment plan as needed throughout their care journey. Within the management section, users have the option to review and record immunizations, smoking status, and document whether interventions were discussed. Users may also include an evaluation of the patient's exercise tolerance and overall quality of life, which helps guide management and treatment adjustments. In the medication section, clinicians can use the medication reference table to review best practice medications when initiating or optimizing treatment, as well as document medication adherence and response. This section also encourages clinicians to involve the patient in shared decision-making regarding their medication plan. A key feature of this tool is the medication plan section, which recommends an individualized treatment plan options based on CTS severity, incorporates lab results such as the CAT and dyspnea score, acute exacerbation severity and frequency, and spirometry results. It also allows users the flexibility to select the medication treatment plan they have independently managed. Action plan and prescription for COPD flare-ups are also included in the medication management section and will be copied to the patient care plan to reduce redundant documentation. To the Resources and Patient Care Plan, which is a consolidated form that houses a library of resources and tools for all the conditions in the E2P tool repository. At the end of the visit, users will click on the Generate Summary Note Complete Form button to close the form. By doing this, whether a few sections or all of them were completed, the tool will generate a summary note, pulling in all the information documented in the tool and copying it into the patient's notes section of the EMR for users to review. Users will always be able to review the original form by clicking on the Click to Expand button, which will trigger the whole tool to be visible. User and installation guides are available for download on the community portal. If you do not have an account, please visit this website. The change management team will be happy to support you if you require assistance with installation. Please reach out to Evidence2Practice at cep.health. Dedicated to supporting primary care clinicians, allied health professionals, and clinic staff, the eHealth Center of Excellence offer guided tool installations and technical setup and guidance on how to optimize the integration of the tools into your existing workflow. In addition, our partners at the Center for Effective Practice can offer supplementary one-on-one discussions with an academic detailer on balanced, evidence-based information. Learn more or sign up at E2P.ca today.